Good afternoon. My name is Alexandria Hansen. I'm a graduate student at East Texas A&M Commerce University. Today I want to be discussing the epidemiology project that we were tasked with this semester. It will be over HIV in adolescents ages 13 to 24 years old. So let's go ahead and get started. By discussing the significant challenges within the youth, again ages 13 to 24, we can identify the limited access to healthcare that impacts them negatively, which can also lead to higher risk of risky healthcare behavior, which increases their vulnerability and health issues towards HIV. This demographic have a higher risk due to them being exploited, maltreatment, sexually abused, sexually transmitted diseases, opioid use disorders, because this age is very impressionable. The epidemiology of this adolescent youth group will be identified within globally, nationally, and within the United States of America. The Lone Star state of Texas and Dallas, Texas, specifically as a local hub, which is my residency, which is why I picked this demographic. We will understand the contributing and heightened health risks that are identified as mitigating challenges by improving healthcare and accessibility, and as healthcare providers, we can identify and target health education towards this demographic and their parents, their foster care parents, their home health care, whatever we need to do to identify and help this group of demographic. We want to be able to do that as healthcare providers. So let's go ahead and get started on the background. HIV is the autoimmune disorder that impacts the infections. So, for example, your body has white and red blood count cells. White blood count cells are where you fight infections. So this is going to be like if you have the common flu, or since we just went through a pandemic, the COVID-19 pandemic, your body fights off infections through the white blood count cells. If they're extremely high, that means you have an infection. HIV is specifically within that white blood count cells. So we want to make sure that we are identifying issues that contribute to HIV. This could be due to sexual contact, contaminated needles, and unsafe injections. These risk factors can also be, again, going back over this a little bit more specifically, anal or vaginal sex without a condom, having additional sexually transmitted diseases or infections, so that can be syphilis, herpes, chlamydia, gonorrhea, or vaginosis. It can be alcohol use disorders, substance use disorders, or opioid use disorders. Again, we're talking about a very impressionable demographic. Hey, would you like to jump off this building? Yeah, if my best friend's doing it, I might as well do it, right? I mean, we all talk about that with our parents, and our parents always warn, well, would you ever jump off the building? Maybe, if my best friend does it with me, right? So again, we want to remember that this is a very impressionable demographic. We can also identify that this demographic uses syringes, such as needles or contaminated needles due to injectable drugs or whatever else they might be injecting themselves with. This could be blood transfusions or tissue transplantation. With tissue transplantation, this more specifically identifies like under the table transplants. So for example, if I went to like a third world country where they don't have healthcare like America or a first world country would have, they typically don't blood test or check for STIs or other diseases that might be in those organs. So again, this could be another issue that might be in this demographic if they could not afford or have limited access to healthcare and they needed an immediate surgery and they were worried, and somebody's like, hey, let me give you the surgery under the table. That's kind of more what that is describing. However, that's very limited and very few. We would also understand medical procedures of unsterile and cutting, piercing. Like, I have a piercing right here. If I went to an unclean shop, could definitely get sick. This could also be, your surgeon doesn't clean their hands very well, and then they didn't clean their utensils very well, or their scalp, or something like that. That can also impact from a healthcare perspective of contamination. Again, contamination is very detrimental to the body. So addressing the foster care situation. So foster care children endure a lot of maltreatment. This could be violence, neglect, exploitation, peer pressure amongst peers, or leads to increased reports of child abuse. And there are about 400,000 children that are entrusted in America's welfare system. 78% of those individuals have entered foster care and come from social problems within the family. So again, this is going to be domestic abuse, domestic violence, parental or substance use disorders, and more violence in that demographic, or sexually abused. Just a slew of health issues that impact this demographic in a negative aspect. HIV risks among this foster care can also be due to homelessness. You're aging out of the system. Once you're 18, no one can really adopt you. 90% of people that age out of the system lead to drug or alcohol use disorders, or end up going to juvenile or having delinquency issues when they're younger adolescents. So a lot of those issues can be contributed due to the maltreatment and the mental health aspect of this demographic. There is a lack of research amongst HIV risks in this demographic due to them being a protected class and a vulnerable population. So instead of focusing specifically over foster care children as a whole, I just focused on 13 to 24-year-olds that happen to have HIV. There are about 20,000 in foster care that have lost financial, educational, or social support. The HIV prevalence among this demographic, again, in 2023, were 120,000 children acquired HIV globally. HIV statistics in foster care within Texas in 2022, there are approximately 369,000 children in the state of Texas on welfare, and 22,000 of those 22,493 specifically were foster care cases. HIV rates in Texas were 114,221 in total. 4,107 of those HIV cases were 13 to 24-year-olds. So again, you could allegedly say that HIV is a high-risk health issue within the state of Texas, but the state of Texas is a very big place. So that is about probably like 1% of the demographic. Within Dallas, Texas alone, there were 650 reported cases within 13 to 24-year-olds. Again, going back over, globally, there were in 2023, there were 630,000 people died from HIV and HIV-related health issues. This has declined by 51%, which would add up to 1.3 million across the nation. So that's the entire United States. 76,000 died from HIV-related healthcare issues in 2023. The highest HIV rates amongst this demographic as a nation was 25 to 34-year-olds, which would be 12,700 new cases. Ages 13 to 24, there were 6,400 new infections, accounting for 20% of new infections. In the state of Texas alone, the mortality and morbidity of this data showed in the graphs. And so as you look at these graphs down here, all this data that I'm talking about are specifically in these graphs also. So going back over this real quick, Texas mortality and morbidity data showed that death was not directly related to HIV, or I could not find any data that specifically related to the demographic of 13 to 24-year-olds. However, totaling deaths amongst this demographic were 4,602 deaths. Dallas County had, between the ages 13 to 24, there were 454 deaths within Dallas, Texas. Again, the data did not specifically state whether or not they had HIV or not. They just stated the number of deaths. So with that being said, you're going to have to take this data again with a grain of salt, because the data would technically be skewed due to the fact that they did not identify them as HIV positive, again, because they are a protected class of citizens and very vulnerable population, and due to that, there was no accurate data to state. The only data that did show specific health issues on the Texas Health Data website was infant mortality rates, vehicle-related deaths, and youth suicides. Those were the only data that you could actually pinpoint the cause of death. Other than that, if they were between 13 to 24, it just showed how many died. It did not state cause of death. Again, the major health issue still remains to be HIV amongst this demographic of 13 to 24-year-olds. The direct correlation between foster care and HIV rates are still inconclusive. However, based on this information that presented today, we can state that social determinants of health and lack of healthcare access and poor behavioral health can impact HIV rates. This can also be an increase of substance use disorders, mental health disorders, being sexually assaulted, or having domestic violence being a contributing factor. I'm so sorry, I cannot get that out. This can also impact this demographic in a negative way. And so as healthcare professionals, we want to advocate for change, educate the foster care and homeless populations. We want to lower HIV rates through prevention programs. And since I do work at Parkland Community Health Plan and the Parkland Health hospitals here in Dallas, Texas, I would like to work very deeply with not only Dallas County Health and Human Services, but with my own medical hospital to impact and improve healthcare changes and access to healthcare amongst this foster care youth. Because this could all be a preventative program, and I'm all about preventative healthcare. My biggest issues with preventative healthcare is that we don't do enough. If we could impact these aging out of the foster care system children and get them at a younger age, then maybe we can lower these HIV rates through these prevention programs, which I would really love to do. And so thank you so much for taking the time today to listen to this presentation. If you have any questions, you're more than welcome to click on my information. You can reach me at Parkland Community Health Plan. My number is 214-393-7003 and extension 355. Or you can email me at alexandra.hansen@phhs.org. Thank you so much, and I hope you have a blessed day. And please give me a call if you want to address these health care issues amongst 13 to 24-year-olds that just so happen to have HIV and also could be potentially foster care and aging out of the system children. Thank you, and have a great afternoon.